I'm Dr. Lalita Shivani, Assistant Professor Pharmacy, working in Malla Reddy Institute of Pharmaceutical Sciences. Today I'm going to explain the topic medication errors in the subject clinical pharmacy. So medication errors. So medication safety is a major critical aspect in the present healthcare system. So any medication errors have been occurring in the hospital organization due to the less knowledge of the patient or less knowledge of the pharmacist or delayed information or not giving proper information to the patient by the pharmacist or the doctors or the physician. So to prevent these, the unit dosage systems, IV admixtures have been improved in this hospital settings to improve the safety of the medication use. So mainly in a particular organization, medication use system will be used, which includes selecting, procuring, prescribing, preparing, dispensing, administering and monitoring of the drugs. Here, the selecting and procuring involves the formulary establishment and purchasing of the drugs from the retailers. Prescribing is the patient assessment and drug selection according to the condition of the patient and also the comorbidities present in the patient. And preparing and dispensing the drugs according to the prescription that is given to the patient. Whereas administering is the assessment and drug administration by the nurses in the ward or by the patient itself in an OP conditions. And monitoring, response assessment and error reporting. If any areas of medication errors are present, they will be reported in the respective monitoring section. And now the definition. Medication error is an episode associated with the use of medicine that should be preventable through effective control systems. So according to the United States National Coordinating Council, the medication error is defined as any preventable event that may cause or lead to inappropriate use of medication. So this inappropriate use of medication can be done by the due to the prescribing errors or by the physicians in the prescribing the medications, by the nurses in administrating the medications, or during the dispensing or during the preparation or dispensing of the medications. So at all these stages the medication errors can be occurring, and to prevent this the necessary actions are taken. So according to the American Society of Health System Pharmacists, the medication errors are of the following types: prescribing errors, omission errors, wrong time errors, unauthorized drug errors, improper dose errors and wrong dose errors. So prescribing errors is majorly done by the physicians during the prescription due to the lack of knowledge of the patient health. Whereas the omission errors by the patient, it can be done by skipping the doses or skipping the dose time or taking the overdose. And wrong time errors, missed doses or static doses, delayed doses or delayed static doses will be done in wrong time errors. And unauthorized drug errors, it is not by the physician or clinical pharmacist. So the OTC drugs will be coming under this category. Whereas the documentation errors, illegible handwriting or incomplete medication history or any spelling errors of the drugs can be coming under the documentation errors. Whereas improper dose errors, administration of the dose that is greater than or less than the prescribed dose. And wrong dose errors, it can be due to the IV, due to the missed route of administration, that is IV, which is given as IM, or oral, which is given as IV. Those type of errors will be coming under the wrong dose errors. Question. So let's come into wrong drug preparation errors, wrong administration or technique errors, deteriorated drug errors, monitoring errors, compliance and other medication errors. So wrong drug preparation errors include drug product incorrectly formulated or manipulated. So mainly the dosage forms can be missed in this type of wrong drug preparation. And wrong administration or technique errors, it is improper technique of administration, that is if the drug is administered not properly according to the route of administration. And also deteriorated drug errors, giving the expired drugs can be coming under the deteriorated drug errors. And monitoring errors, so failure to review the patient which is prescribed according to our therapy, whether the disease progression patient, whether the therapy is getting, patient is getting a proper outcome or not. So if it is not properly monitored, it comes under the monitoring errors. Then compliance errors, failure of the patient to adhere the medication that is prescribed by the physician, or not able to understand how to take the drugs. That comes under the admission or compliance errors. And other medication errors also will be present. Next, according to the National Coordinating Committee on Medication Error Reporting and Prevention, that is NCCMERP. So medication errors will be classified into these type of categories from A to I. So in this, the A category of medication errors will be the circumstances that may cause error, whereas the B and C categories of errors will be error occurred but no harm. So here the medication errors have been occurred, but the patient is not getting any harm due to the medication error that is caused. Whereas the category D comes error occurred, monitoring required and no harm. An error has been occurred, but not much harm is done to the patient, and the monitoring is required to prevent the further harm. Whereas E and F categories, it is the temporary harm to the patient and intervention is compulsory required to the onset, otherwise it leads to the harmful reactions on the patient. Whereas G and H category is error, permanent error will be caused, which is life-threatening to the patient. Whereas I category is error which causes death to the patient, which is very severe. So need to be cautious. So this is the categorizing the medication errors according to this organization. Next, coming to the factors or causes of medication errors. So mainly there are 5 major causes for any medication error to be occurred in an hospital organization. First comes under factors associated with healthcare professionals. So in this majorly it will be with the lack of therapeutic training or lack of knowledge by the physician to explain to the patient, or lack of knowledge by the physician about the particular disease or the therapy to be given. And factors associated with the patient, it is mainly medication inadherence, means the patient is unable to understand how their condition or seriousness of their health condition, and in that case their medications will not be taken properly by the patient, causing the medication errors, causing the medication skipping or dosage errors, which leads to the improper outcome. So that comes under the factors associated with the patient. Whereas factors associated with work environment, workload, overworkload, or time pressure or less staff members to explain properly to the patient or to monitor the patients, that comes under the factors with work environment. And factors associated with the medicines, lack of proper labeling or lack of maintaining the proper sterility of the compounds will be coming in this part. Whereas factors associated with tasks, repetitive systems, or unable to maintain the proper documentation of the patient or proper collection of the history of the patient, that comes under these factors. Plus factors associated with computerized information systems, whereas lack of improper maintenance of the electronic medication records or lab investigations or any other parts will be coming under this lack of proper information. So these are all factors which are associated with causing the major medication errors in a particular hospital organization. Next, coming to, so these, and mainly we need to concentrate on 2 types of or 2 categories of drugs which cause most of the medication errors in a particular hospital organization. Those are the high alert medications and LASA drugs. So the high alert medications comes anticoagulants, insulins, opioids, hypotonic salines, concentrated ACL and chemotherapeutic medications. So in these medications, very less dose changes or missed doses will be causing very serious effects to the patient, causing even death of the patient. So anticoagulants, the warfarin, heparin, they should not be given when the patient is having any surgery or the patient is having any injuries or wounds, because it causes lack of this, it leads to overbleeding when these medications are being used during this surgeries or bleeding time. Whereas insulins, if the insulins are not given at the proper time, the hyperglycemic or hypoglycemic conditions may be occurred to the patient, resulting in drastic changes or contraindications or serious effects on the other organs in the body. And opioids leads to this addiction, and hypothalamus solution, if not given properly, causes death. And concentrated KCl, if not given in diluted form or given in higher concentration, cause severe effects. Whereas chemotherapy, narrow therapeutic drugs are majorly involved in this chemotherapy, and in the small dosage fluctuations will cause serious effects of the patient. Whereas the Lassa drugs, these are look like and sound like drugs. Example, hydroxyzine and hydrolazine, and carbamazepine and carbamazole, prednisolone and prednisone. So these type of drugs, these majorly cause these prescribing errors. And metformin is a hypoglycemic drug, as peptidazole is an antimicrobial drug. So drastic change is present in the therapy if this medication is being altered. So look like sound like drugs should be majorly concentrated to prevent this medication errors. Next, detecting and reporting the systems. So detecting and reporting systems in a medication error. So instead of the reporting, chart review, direct observation, trigger tools, pharmacovigilance. So, and these are the organizations where this data to be uploaded or given information to count this medication errors, or to give this percentage of how much medication errors are being caused. And this incident reporting, this can be done by the healthcare staff by self-reporting. And chart review, this can be the retrospective method where the old case sheets can be reviewed for the medication errors. Direct observation is the real-time observation where the patient is in the hospital. Trigger tools, where any global trigger tool is used for the detection of the harm. And also pharmacovigilance, that is the ADR reporting. And these are all the organizations where the database will be uploaded. MedMarks, MedWatch, NRLS for UK, and ISM, MERP, Medication Errors Reporting Program. So these are these types of organizations. So these are the types of medication errors which has been detected for the latest information. This prescribing errors, which include wrong dose, dose group, frequency errors, which is 56%, transcription errors, that's misread errors, which comes under the Lassa drugs, and transcription mistakes, which is 6%, dispensing errors, wrong drug dispense or labeling errors, which is 14%, and administration errors of 22%, that comes under the wrong time, wrong patient, and wrong technique errors. And what is the role of pharmacist in maintaining this medication safety or preventing this medication errors? So majorly, pharmacists as a safeguardian, they are mainly involved in the dose calculation to prevent the overdose or less dose, prescription verification to prevent this Lassa drugs or ILR medications, drug interaction screening to prevent any drug-drug interactions or drug-food interactions, and formulary management, uploading the latest information of the drugs that are present in the hospital, and also error reporting, ADR reporting or medication error reporting to count the percentage of errors that has been causing in a particular organization, clinical review of the patients, patient counseling about the drugs, their adherence, and also medication reconciliation, which is a systematic process to create the most accurate list of all the medications a patient is taking. So this comes under the polypharmacy conditions where different types of medications will be taken by the patient, and the pharmacist will review every medication, their interactions, and also their uses for the particular condition. So in this way, the pharmacist will be involving in every part of the organization to prevent this medication errors. So technology, the latest technology in this prevention of the medication errors are the computerized physician order entry, real-time drug safety, and beside scanning technology, that is barcode, giving barcode to each medication to prevent dispensing errors. Whereas this real-time drug safety alerts, drug-drug interactions and drug allergic interactions can be detected. And this is computerized physician order, so prevent this handwriting mistakes, and also automated dispensing cabinets will be present where the drugs are being stored in particular alphabetical order or barcode section to give this drugs without any dispensing errors. And smart infusion pumps to be given for this CV insulin pumps are used, CV patients adrenaline pumps are used. So these insulin pumps will be giving this medication at the particular rate without any monitoring or without any check, manual infusion with the help of the nurses. And electronic medication reports will be having all the documentation which can be reviewed easily when the patient will be coming for the reviews. And lastly, discussing a few examples for this detection of medication errors. That is, first one is the insulin overdose. The physician wrote unit 10, which means U10, which means 10 units, which is misread as 10U, that is 100 units, and given 100 units to the patient, which is an overdose of the insulin causing hypoglycemic condition. So this is a abbreviation, misread errors or prescribing error. Next, coming to next administration route errors, where IV drug is given, whereas it is accidentally administered intrathecally, causing administration errors. Whereas this prescribing and monitoring error is methotrexate, which is methotrexate is a weekly drug which is prescribed as a daily drug for the rheumatoid arthritis causing overdose of this drug. So that is prescribing and monitoring of the drug. So in this way, these are the examples where different types of errors, some of the examples where different types of errors are caused. So this is the medication error topic of clinical pharmacy.